teammates. Welcome to the Live Well podcast. I'm one of your hosts, Jen Collins.
And I'm Seth Christopher. Welcome to the Well.
Hello, everybody. Welcome to another episode of the Well podcast. Seth, we have sprung forward.
We have. Feeling a little tired today, but ready to rock and roll, and really excited, teammates. You've joined us today to talk about a very important topic.
Yeah, this topic is so fascinating, and I feel like every time I'm excited about today's topic, but this one is different. We've taken a little bit of a different turn. We've been talking about nutrition. March is National Nutrition Month, so we've really been talking about what all that entails. And today we have a special guest who's going to talk to us about food insecurity.
Yeah, I definitely feel like the topics are related, not necessarily one that is highly publicized. I think if it's food insecurity and is something that if you're close to in your community or you're talking about, maybe it's a little bit more top of mind, but it's not always something that comes to top of mind when we talk about Nutrition Month. So I am glad that we are able to shine a light here at the Well.
Yeah, let's jump in. Give me some fast facts.
All right, fast fact. It's estimated that approximately 15.8 million U.S. households are affected by food insecurity. That's approximately 12.7% of all U.S. households. Now, what exactly is food insecurity? As defined by the United Nations Subcommittee on Nutrition, it's the limited or uncertain availability of nutritionally adequate, safe foods, or the inability to acquire personally acceptable foods in socially acceptable ways.
That's a mouthful.
Long story short, it's not necessarily the lack of the ability to get food in general. It's the lack of ability to get to nutritionally sustainable foods.
I think that's an important fact to kind of distinguish against. I'm glad you had that one.
Fast fact. Food insecurity has been shown to have a strong correlation to negative health outcomes. In fact, a recent study through the USDA found that lower food security is associated with higher probability of many chronic diseases like hypertension, coronary heart disease, hepatitis, stroke, cancer, asthma, diabetes, arthritis, COPD, and kidney disease.
That's incredible. Just all from not having high quality or adequate foods. Like I don't know that we think about it in those terms, that it can affect chronic conditions.
This particular study just sort of sliced out the 10 major chronic diseases identified by the CDC. However, the research has been there for years, really looking at the associations of low food quality, low food insecurity, high food insecurity, and then high incidence of chronic disease and high prevalence.
Very interesting. And our guest is going to really touch into that. She has a real passion for disease prevention and disease management. So I'm excited when we get to her when she talks about that point. Let's do some myth busters. Let's see. Myth number 1. There's a hunger crisis in other parts of the world, not in America. So as you already kind of alluded to, 35 million people face hunger in the United States. That's more people than the entire population of Canada. Across our nation, they're just struggling to make ends meet. And I think we've probably seen that more and more in 2020. Due to high housing costs, rising food prices, and unexpected expenses, millions have been left unable to stretch their dollars. Sometimes, after a long day of working, they are able to put a warm meal on the table, but other times they go to bed hungry.
Wow.
I just hate that. Like that just hurt. It just hurts my heart.
35 million people facing hunger in the United States. And then I haven't even potentially considered the COVID impact.
Right. Exactly. Myth number 2, people who face hunger in America are typically homeless and unemployed. So that's the myth. The fact is, most of the households served by Feeding America, which is where I got this information from, are not homeless, and they have at least one working adult. So even with housing and a job, many people struggle to get by due to challenges like underemployment, stagnant wages, and rising cost of living. According to a recent report by the Federal Reserve Board, if Faced with a $400 emergency expense, 40% of American adults would either need to borrow money, sell something, or not be able to pay their bills. Feeding America is just one group that's committed to helping households weather life storms. And when you just sort of think back on 2020 and COVID, can you just imagine how some people were getting by?
I can't. And we've addressed some pretty big, I don't know if it's stereotypes, but just maybe it's a narrow way of thinking when it comes to food insecurity. One of the biggest barriers just being access. It's certainly a big problem, but there's also a big problem with not having high quality access. And then we often think about people who are hungry or don't have food. It's because they're either homeless or they're unemployed, and that's just not the case.
Mm-hmm. What's interesting is if you think about children, right? So a lot of kids, especially in North and South Carolina where we're located, they get their warm quality meals from their school. So when schools shut down, that created a huge need. And I know in South Carolina and Fort Mill and in our district, and I think in yours as well, the schools really came together and they partnered with other food pantries to still provide those foods for kids who had that need, So that it's just, when that happened, it was such an eye opener, because I don't know that we think about that all the time. I just don't know that we consider everybody in their needs.
Well, you brought up a great point, Jen. It's a great segue. There are a lot of just amazing partners out there in our communities and across the nation who have done some really amazing things to try and provide quality food and access to food to people who really need it. And we are fortunate enough to be able to have on a guest today who has been making an impact here in the greater Charlotte community. So maybe we'll take some time and introduce Latoya and have a great conversation. What do you think?
Yeah, let's get her on. Latoya is the project manager of One Charlotte Health Alliance, where she oversees operations of a mobile food pharmacy program. She supports the mobile food pharmacy by coordinating with community stakeholders, the wonderful staff at Loaves and Fishes, and the health systems. Latoya has a passion for disease prevention, especially among vulnerable populations, by providing our patients and community members in need with healthy groceries, access to nutrition education, and healthy lifestyle management classes. She believes this will help to prevent additional hardship as a result of chronic disease. Latoya, welcome to The Well.
Thank you for having me.
I'm so excited to have this conversation today. I want to kick it off just by kind of a general question. What is One Charlotte Health Alliance?
So One Charlotte Health Alliance is a partnership between Atrium Health, Novant Health, and Mecklenburg County Public Health Department. The overarching goal of the organization is to to connect community members in Charlotte or Mecklenburg County access to health resources.
Wow, Latoya, it really sounds like One Charlotte Health Alliance is doing a lot, not just for our teammates, but for the greater communities that we serve here in the Charlotte area. So really impactful stuff.
Yes, thank you so much. I'm really excited. This is, something that is near and dear to my heart. Disease prevention is a real passion that I have.
So Latoya, what is food insecurity?
Food insecurity is when an individual lacks resources to provide consistent access to enough food for an active, healthy life. So back in October 2019, Loaves and Fishes conducted a client survey just to, get a pulse point on the demographic of the clients they provide food for. And the sample size was a little over 1,100 heads of households, and 60% of their clients reported having high blood pressure, 35% reported having diabetes, 25% reported having high cholesterol, 24% reported having asthma, 11% reported having heart disease of some type. 94% reported saying that they worry about running out of food, and 90% mentioned having they've run out of food without money to buy more. And that speaks volumes to, how important it is to provide community members with healthy food. Could you imagine, um, having any of these chronic conditions and not having enough money to buy healthy food, and your only option might be the fast food dollar menu or the 15-cent ramen noodle. Like these things, those foods, those cheap quality foods, we already know just exacerbate chronic disease. And that's what we hope to, at the mobile food pharmacy, combat that. We believe food is medicine. So we believe that by providing people with the more healthful choice, the more healthful option, that we will help them to alleviate some of that problem or lift that burden.
Those are staggering statistics. I just can't imagine having to decide between my medicine or food for the family.
Yes. Unfortunately, there are people who are making that decision on a regular basis.
And y'all are providing such a great bridge for that gap.
Thank you so much. It takes a team, and we're all equally as passionate.
Great, and you can certainly see how not having just the essentials of just the healthy foods, but access to food in general can create problems that are systemic. And it sounds like a lot of the work that you're doing with One Charlotte Health Alliance really is focused on that. And as a result, hopefully helping to prevent some of the onsets or the additional comorbidities that come along with one or more chronic diseases. So maybe talk a little bit about how's the work that you're doing helping with food insecurity? What exactly are you all addressing there?
So having access to healthy food plays an important role in an individual's well-being. So in healthcare, we know that individuals who suffer from food insecurity have an increased risk for developing chronic diseases. Like, for example, our most common ones are diabetes, hypertension, and other things like cancer, things like that. We're not battling malnutrition. Like often when we come to the food pharmacy or any food pantry, we're really not dealing with people who are really skinny or, malnourished, I'll say that. It's the food quality issue. So when we provide people who are at risk for developing these chronic diseases, if we provide them access to the more healthful options, it could definitely have a positive impact on someone's health. Because if you think about it, food is the foundation, right? And it kind of is like a domino effect on all the other social determinants of health. So take, for example, if someone who was low on money, which is like poverty is the root of all of the, economic implications from the different social determinants of health, right? Mm-hmm. If someone, say someone is food insecure and they have diabetes, if they're low on money and they're eating poor quality food, it could easily make someone's A1C spiral out of control, which would lead to them, it could lead to unnecessary doctor's appointments or emergency room visits from an out of control A1C. Or if someone has hypertension, if they're low on food or low on money, they may not be able to afford their hypertension medication, their blood pressure medication, or if their blood pressure goes out of control, that could end up in the emergency room. And all these things that results in money, right? Mm-hmm. Health services are not free. So when we provide someone with healthy food to help them at the very minimum control their disease, or at least not help contribute to exacerbation, I feel like we're doing a good thing, or our program has a positive impact in that way.
I think you make a really good call out here, Latoya, and something that really resonates and is worth mentioning again. The distinction between food insecurity being that not so much a barrier to access, but rather the access that individuals have is not high quality, or it's low quality. And so I think that that's a really good distinction, because sometimes when we think about it and in the context of social determinants of health, and we think that the real big barrier is access, but what you're addressing is something much more nuanced in the fact that there's access. It's just what they have access to isn't great quality. So really great distinction, and that's exciting work.
Mm-hmm. And I will say, the county and organizations are becoming more mindful. So now you might go to a corner store or a gas station and you see they accept SNAP benefits, or they partner with farmers markets and things like that. So the more healthful, like fresh produce options are becoming more readily available, but still there are community members who live in what we call food deserts, where they don't have it's not as convenient for them to go to a grocery store where they have a produce department and things like that.
I think a lot of us may take it for granted, this issue of quality of food. I just find that to be so interesting, not just the access, but the quality. So it's a different perspective to take for sure. So how does the mobile food pharmacy help to address this particular issue?
So the mobile food pharmacy, so the One Charlotte Health Alliance mobile food pharmacy, we partner with Loaves and Fishes. Loaves and Fishes, you may not be aware, but Loaves and Fishes is a network of food pantries across Mecklenburg County. And we work together to operate the mobile food pharmacy, and we address food insecure patients or community members by providing them with a week's worth of nutritionally balanced groceries. And that just means food from every food group. We provide a few shelf-stable items. Those are things that don't perish, not refrigerated. And then also we have perishable items like lean meat, dairy products, cheese, milk, things like that need to be refrigerated or frozen.
And Latoya, you said it for an entire week, and is that just for the patient, the teammate, the community member, or is it for the entire household?
It's for the entire household. So when someone receives a food pantry referral, they will provide the name and date of birth of everyone in the household, and they'll receive 1 week's worth of food that will feed everybody in the household. And you're allowed up to 12 referrals a year at Loaves and Fishes, and that means they can go, to the mobile food pharmacy, and then also if for some reason or if that particular day that the person was in need, they could go to another food pantry and get the exact same thing.
So this is interesting. So it's not just a walk-up grocery or food pantry. You have to have a referral for this. Where would one get a referral from?
So a referral can come from the medical doctor's office, so your healthcare provider, the pastor of your church, HR at your job, anyone over at the Department of Health and Human Service, or any of our friends over in the government buildings. And even some nonprofit organizations have referring agents or people who are qualified to send referrals to Loaves and Fishes.
And amazingly, you said that each referral gets you a week. You can get up to 12 weeks. So if I'm doing my math right, and sometimes I'm a little wonky here, but it seems like if someone gets 12 weeks, they can essentially, or 12 referrals, they can get 12 weeks of food for their family with high quality meals. Is that right?
Yes. So, and there's no limit to how frequent. So a referral, you can only get one referral per week, but other than that, if you needed food 12 weeks in a row, you can get it that way. If you needed a referral once per month, you could get, a referral every month for a whole year. So it's totally according to the need of the family. Often, like people who receive SNAP benefits or food stamps, what we've noticed is like sometimes at the end of the month, we have more busy, more traction or more referrals towards the end of the month, and we can tell maybe, or we can assume that maybe their SNAP dollars have ran out.
So you're providing a week's worth of food. What else are you providing? Because as we've talked about, and we actually alluded to in your intro, y'all are providing a lot more than just food, aren't you?
Yes. So we have a few, like I mentioned before, we have, not only do we provide access to healthy food, but we also have a nutritional education component. And that's what sets us apart from other pantries, is that we address the health aspect of food. We work closely with the registered dietitian. Her name is Chastity Glover. She's the licensed registered dietitian at Loaves and Fishes. We have a specialty food box program, which is targeted toward clients with chronic conditions, specifically hypertension and diabetes. We've also partnered with Cabarrus Health Alliance to establish a free diabetes prevention program, which is really great. We're so excited about that. And then another thing is, March is National Nutrition Month. So we are really spreading the word, and we have weekly themes in honor of this national recognition in regards to nutrition education and additional things that we're providing for our clients.
That's just amazing. It's almost like a white glove service you all are providing. Excuse me. Being able to not only get access to high quality foods, but high quality foods that have gone through a rigorous analysis with the registered dietitians and other clinical teams to make sure that you're providing a box specific to a potential condition, diabetes, hypertension. I just find that that's an amazing setup you all have done, and I'm just amazed.
Yes, I'm really proud of the specialty food box program, and like I mentioned before, it really, when someone is food insecure, like we already know, the statistics show that people who suffer food insecurity have increased risk for chronic diseases. When we provide someone who is low on money, low on food, when we give them, this more nutritious box, the money they save from not having to go to the grocery store, they can use that to, put gas in their car to get to work, or to take their child to daycare, or they can use that money to pay a utility bill, just all types of things.
That sounds awesome. And those are specialty boxes that y'all put together that have certain ingredients. They have recipe cards that they can mimic down the road. And is that a special program you're doing just for National Nutrition Month, or do you usually do that?
So right now, for the month of March, in honor of National Nutrition Month, if you go to the National Dietetic website, there you'll see that there are weekly themes, and we are adhering to that. So week 1, which was last week, the theme was eat a variety of nutritious foods every day. And so to honor that, at the food pharmacy, we distributed special recipe boxes with ingredients and a recipe card. And the recipe was called sweet potato nachos. I'll have to share it with you. Maybe we can share it with our teammates. It looks beautiful, and it's super healthy, and the recipe is so lean that it allows for our clients to be able to, they can add things if they would like. It's a vegetarian recipe, but if they wanted to add meat or avocado or whatever it is they like, in addition, it could totally work.
You said my favorite word, nachos.
Nachos, yes. So normally when we think of nachos, it's like the tortilla chip, right? But the way it goes, you take the sweet potato, slice it up, bake it, and you actually eat it like you slice the sweet potato, and the sweet potato acts as the nacho. So it's super healthy. And of course, you get lots of nutrients from the sweet potato. It'll be more filling, and of course, it'll be much more healthy for you. But if you like nachos, go ahead and add that to the mix also. You can make it however you like.
Sounds so fun. I love sweet potatoes.
Yeah, everybody loves sweet potatoes, especially here in the South.
Mm-hmm.
Well, you've got a lot of recipes that sound delicious. So it's not just kind of your box and go. We talked a lot about the effort you all put into providing the quality, but knowing that, I mean, we can potentially have nachos of a variety, if you will. I think that sort of hammers it home for me, and hopefully for teammates listening and trying to spread the message, being able to push that across, that message. I think it's important.
Yes. And another thing for week 2, the theme is plan your meals each week. And then we'll be this week we've been distributing what Chastity, or the registered dietitian, created, the mock grocery list. And the purpose of that is to educate our clients on how to make healthy food choices in the grocery store. If they can use it as a guide to when they shop for certain food groups. We have a few things that you can pick and it could help them. They could use it as a guide to make healthy choices. And not only that, but it helps you to save money. We already know, and we all know, we've been to the store. When you don't have a list, you tend to buy so many things that you don't need, and then you're spending a ton of money. And often our clients don't really have a whole lot to spend. So it's much easier when they have a specific list with healthy items, and they can take it and shop from there.
It's so dynamic. Y'all are doing more than just providing food. You're providing a new way of life for individuals who could really use both some food and then some education. It's got to be so fulfilling.
It is. I love being in this role. Like I said before, my passion has always been disease prevention. And I feel like what better role than in this current position, overseeing the mobile food pharmacy, where, like I mentioned before, the foundation of our life is the food we put in our mouth. We believe that food is medicine, right? We're not trying to in any way tell people to not take their medications, things like that. But we know that what someone eats, the food they have, has a direct effect on, your health outcomes, right? And like I mentioned before, we're not suffering, it's rare that we don't see people who are suffering from malnutrition or malnourishment. It's a food quality problem, right? When we eat the SAD diet or the standard American diet that's filled with processed foods and, dollar menus and, ramen noodles that cost 50 cents, those are the things that, exacerbate chronic disease like diabetes and hypertension. So our goal is to educate our clients who are suffering from food insecurity on how they can, shop for food on a budget, or how they can make healthful choices at the food pantry, or if they have to shop at Dollar Tree to get food. So we want people to be healthy as they possibly can, regardless of their circumstance.
That's such a powerful message. And for a majority of our listeners or teammates, how can teammates advise people in their circle? How can they get to you? What are some of the ways that they can do that again? So
in order to get a referral, like I mentioned before, a referral can come from your primary, or not just your primary care, but just your doctor's office, any clinic. Your medical doctor can make a referral. The pastor of your church can make a referral. A social worker, a caseworker, anyone from over at the Department of Health and Human Services, and even other nonprofit organizations can make referrals also. There really aren't that many barriers to getting food from Loaves and Fishes or the mobile food pharmacy. And even right now, so I will say this, due to the pandemic, we have seen an increase in the amount of people who need food that have never needed assistance before, right? So a lot of those individuals they've never known how to go about getting a referral for a food pantry and things like that. So to accommodate those people, they can call Loaves and Fishes directly and speak with the social worker there, and they can, get an appointment or a referral for themselves to go receive food wherever is most convenient for them.
So if we have any Atrium providers who are listening, and you've talked a lot about chronic disease and how we're working on prevention and maintenance through food and getting people connected to this service, if I'm an Atrium provider, how would I make a referral?
So if you're an Atrium provider, or, say you're the office manager or the social worker at the clinic, right? And you have a patient who says, you know what, we just don't have food tonight, and that's why my blood sugar's up, or we just need food, right? All they need to do, the clinician can call Loaves and Fishes at 704-523-4333, and all they would need to do is provide the patient's name, like just some of their demographic information, like their name, date of birth, their address. There are a few questions like, do you receive SNAP benefits? Yes or no. Are you a veteran? Yes or no. And then also provide the name and date of birth of all the other household members, because remember, you want to get enough food to feed the entire household, and that's all it takes. And then based off where they live or the patient's schedule, they will find a pantry that is most convenient for them.
So it sounds like it's very easy. It's just a matter of knowing that this resource is running in the background and asking for help. Just how wonderful.
Yes.
You've given us so much great information about your program. We can hear the passion and love in your voice for this program. It's teammates can access this, community members can access this. One more question. I think Seth had a final thought that he wanted to throw out to you.
So Latoya, you've shared tons of great information. If you had one piece of advice for teammates, what would that be?
My advice to teammates would be, if you have a patient who expresses their need for food, or they've been screened and they've been identified as food insecure, please call Loaves and Fishes to schedule them a food pantry referral. Specifically, we would love to have them at the mobile food pharmacy. The food pharmacy is at 6 locations per week. If you go to the Loaves and Fishes website, our schedule is posted there. But not only that, because our goal is to provide convenience to the patient or the client, right? So whatever is most convenient for them, please call and connect them with nutritionally balanced food for their entire household.
Thank you so much, Latoya, for coming on today and talking to us about One Charlotte Health Alliance and the mobile food pharmacy. Make sure, teammates, that you check out Latoya's story. She is our digital calendar teammate highlight on this month, and she has a wonderful video, and you actually can see her there outside of the mobile food pharmacy. So Latoya, we really appreciate you sharing all this information with us.
Thank you so much for having me. This has been such a pleasure.
Wow, another dynamic guest. We have the best guests here on The Well. We absolutely do. Latoya just has so much passion for the work that she's doing.
Yeah, we do have great guests. We tend to drink our own water from the well when it comes to our guests, but she is doing some really amazing stuff. I'm really blown away about what we're able to talk about today.
And we're going to absolutely put the resources in the show notes so that teammates, providers, anyone who is listening that's interested, that wants to help out, can find this information.
Jen, we covered a lot today. What exactly did we learn today?
Kind of a somber subject today, but with some good news, we learned that Loaves and Fishes is a partnership with Atrium, Novant, and the Public Health Department, and they are doing what they can to provide healthy meals to Charlotte area residents through the mobile food pharmacy. We also learned a lot about food insecurity and that it can lead to increased uncontrolled chronic disease. We talked about teammates. If you are in need of assistance, you can get a referral to the mobile food pharmacy from your healthcare provider, your pastor, the local health department, or other governmental buildings, or you can let us know at HR department in Atrium, and we can provide that referral as well.
And I also learned a lot about the mobile food pharmacy, that it's, based on the conversation with Latoya, it's not just getting access to food. Yes, they are giving access to food, but there is an entire process dedicated to making sure the food that people do get is healthy, nutritious, it's gone through a registered dietitian, and it's tasty. We talked about nachos.
Yeah, they're providing more than just food. They're really providing good care.
Quick call to action, teammates. If you or someone you know of could use assistance with food, please refer them or yourself to the One Charlotte Health Alliance. We're going to post all the information that you need in our show notes. Also, do you want to be a part of something bigger than yourself? If you'd like to help and you feel called to action here, you can sign up to volunteer with the mobile food pharmacy. We'll also place that information in the link.
Our next podcast will be airing on April 1st, April Fool's Day. And on that day, we're going to start a new topic. We're going to be tackling the topic of Financial Health 101 as we discuss all things financial health throughout the month of April.
And teammates, don't forget to visit the LiveWell website for more info on managing stress, working with a LiveWell health coach, access to more LiveWell fitness videos and challenges, and more information on connecting with a dietitian.
Our resources are listed at the end of the show, and we'll add links to the programs discussed today in the comments on our Streams channel.
Looking for more things Live Well? Not following our Streams channel yet? Search The Well on Streams in Office 365 or find us on the Live Well website to access all our content.
Thanks for listening to The Well today.
Stay safe
and live well.